Okay, so what we're doing now, we're going to do manual therapy and stretch for the piriformis muscle. This was a deep muscle. Okay, this muscle is below the glute maximus. It's an external rotator. Okay, this muscle can contribute to a lot of different problems. One called primary piriformis syndrome, which causes deep local pain in the glute and causes radiating pain all the way down to the foot, oftentimes rooted in the lumbar spine. Now, what we do for the tissue work with this, work with me here. We're going to flex the knee to 90 degrees, okay, and then we're going to take it into external rotation to shorten the muscle. We're going to find the greater trochanter, okay, and actually let's visualize a line first. Okay, we're going to find about our center of our sacrum. We find our coccyx, L5, and then we go about the center. We go lateral to that, and then we draw a line between lateral sacrum and greater trochanter. We externally rotate the hip. We're going to start with our thumb. It's a deep contact. It is deep. Deep contact with the thumb, and now, as our lever, we're going to take this hip in an internal rotation to lengthen. Okay. And we're going to work that from insertion to origin. How you doing again? Okay. Elbow is another way. I usually use elbow. Elbow is less sensitivity, though. So we find greater trochanter with our thumb. Then we can go in there with elbow. Guys, the pointiest portion of the elbow you can use. Deep pressure. Lengthen. Lengthen. Okay? Okay? That's manual therapy. Piriformis. Hey guys, we're recording. Go ahead and flip over for me. Hey guys, we're recording. Please shut up. Okay. So, like we said, this muscle's a little confusing because after 60 degrees it turns into an internal rotator. To get our best leverage on this muscle, the best leverage, they're going to be in a supine position. They're going to take their knee to 90 degrees. And then what you're going to do is you're going to externally rotate the hip. And I kind of scoot in the side here like this. Okay. So if I'm doing the left side, I am on the right. If I'm stretching the left piriformis, I'm on the right side. So now I'm in there. Okay. So now what I do is I grab the knee, and what I'm going to do is I'm going to drive this femur back into the hip while I'm applying a little bit of flexion. This is a big muscle too. You're recording, look at my hair. I can see my reflection. Why is it sticking up like this? My stylist says I have 2 calyx on my hair. And I'm like, oh, come on. So anyways, so this muscle here, if we really want to get creative with it, we can make, good. But remember, we're going to get our elbow, we're driving the femur back into the hip. Okay? That's our stretch over the piriformis muscle.